I'm going to talk today about 5 things that show up in almost every single heart disease patient that I've ever worked with. These 5 things are noticed long before their diagnosis. And these are 5 things that they'd actually mentioned to their doctors, but were told it's unrelated, was never treated as part of their cardiovascular care, even after they got diagnosed. So in the next few minutes, I'm going to show you 5 specific signals that your body has been sending that most heart disease patients have dismissed. And by the end of this video, you're going to understand what those signals mean and what you can do about them. Because here's the problem. When you go to the appointments, you get some answers from your cardiologist, but they're skewed. It's your cholesterol, it's your triglycerides, it's your genes, it's your lifestyle. And somewhere along the way, you accepted a version of yourself that is more tired than you used to be, less sharp than you used to be, heavier than you wanted to be. You mentioned some of these things to your cardiologist and were told, yeah, it's normal, it's part of aging. So you stopped mentioning them and you filed them away as if it was just the normal. But I'm going to tell you a little secret. They're not normal and they're not unrelated. The fact that no one has connected them is exactly why the root cause of your heart problem has never been addressed, and it's why you still struggle with your symptoms. So listen, 22 years of practice, thousands of patients with cardiovascular disease, metabolic conditions, and I have seen the same conversation hundreds of times. A patient lists what they think their heart disease symptoms are, or what they think is causing their heart disease. And almost as if it's an afterthought, they say stuff like, well, my brain's been kind of foggy, my weight hasn't been going right. Things that they always bring up with their doctors are assumed to them as unrelated, but in my experience, those afterthoughts are the most important part of the conversation because they signal to what is pointing their heart and driving the inflammatory disease. So here's point number 1. The warning signs of exhaustion that sleep does not fix. Look, fatigue is the most universal complaint that I see in patients over 40, and they're almost always contributing to the same thing, right? I'm getting older, I'm stressed out, I'm not sleeping well enough. Maybe it's an iron anemia or their thyroid's off, and in the medical system, it's investigated superficially. And then it's accepted as background noise, something that you manage rather than something you solve. And most heart disease patients have been carrying this fatigue for years, and they have long since stopped expecting an explanation. So here's what nobody's telling you about the kind of tiredness that sleep doesn't fix. It's not a sleep problem. It's not an age problem. It isn't even stress. Look, your body does not run out of energy randomly. What it does is it runs out of energy when something is consuming it faster than you can create it. So when a heart disease patient tells me they're exhausted in a way that no sleep can fix, it's not a minor complaint that we file away. This right here is the loudest signal that I hear because in 22 years of practice, I have never worked with a patient whose cardiovascular root cause was fully addressed and who still felt tired. So when the underlying driver starts to resolve, the energy comes back every single time, which means the exhaustion you've been accepting as normal is not normal. Persistent fatigue that you're accepting as age is your cardiovascular system telling you that whatever is driving your heart disease, it's still active, it's still running, it's still chasing after you, and it's still costing you. In my practice, when a heart disease patient tells me that their fatigue is better and that they feel better and they're losing weight, it is because we began addressing root cause drivers, inflammation, toxicity, nervous system dysregulation. It's the most consistent thing I see. Not because we're treating fatigue, but because if you fix the root cause that's throwing your body off balance in the first place, restoration happens. So when you stop writing off your exhaustion as just you're getting older and you actually treat it as a signal, everything changes. And that signal is always pointing somewhere. And where it's pointing is where you should look. Okay, the second warning sign is something that most heart disease patients have never even thought about, and they certainly haven't talked to their cardiologist because it again seems unrelated, and it's one of the most telling signs. Your mind is not as sharp as it used to be. Brain fog, difficulty concentrating, moments of mental slowness, these get attributed again to stress, sleep, or age. or just the general overwhelm of living a modern life. But look, they're rarely taken seriously as a medical concern by your cardiologist and almost never connected to cardiovascular disease. Most patients who mention mental cognitive decline at their cardiology appointment are told, that has nothing to do with your heart. Your brain, though, and your heart, watch this, they run on the same blood supply. So whatever's driving the inflammation in your arteries, that same inflammation is traveling to your brain every single day. So when your thinking slows down and when your words don't come out, mental sharpness that you used to have isn't there anymore. That's not stress. It's not genetics. It's not you're getting older. It's the same problem damaging the arteries of your heart. It's just now affecting your brain. Because remember, your cardiovascular system and your brain, they're not separate. They might sound like two separate systems, but they're connected. Your brain fog and your heart disease, they have the same root cause. And look, I've worked with patients who have come in to me focused entirely on numbers, cardiovascular numbers, cholesterol, triglycerides, palpitations, arrhythmias, even EKGs, and they've all mentioned cognitive changes almost as if it's an apology. It's almost as if they're embarrassed to bring up the reality. And when we address the root cause drivers of cardiovascular disease, cognitive function improves. Cardiovascular markers improve. Again, not because we're treating the brain, but because the brain and the heart are responding to the same root cause. So when you connect cognitive symptoms to your cardiovascular root cause, you stop managing two separate problems. You start affecting the underlying cause that is affecting both systems simultaneously. That is way more efficient and more effective than your current approach. Look, we're 2 symbols down, but the next one is the one that most heart disease patients experience, but nobody connects to their heart. And when I tell you what it is, you're going to think about your last few years completely differently. Warning sign number 3. Your digestion has been off for years and no one has connected it. Digestive symptoms, bloating, reflux, irritable bowel, discomfort after eating. These are all managed, right, as gastrointestinal problems by your GI specialists. To the untrained eye, they have nothing to do with your heart. But that assumption has been embedded in the entire structure of conventional cardiology because you see, your cardiologist is a heart doctor and your gastroenterologist is a gut doctor. 2 separate conversations, they never overlap. So we covered this in depth in the previous video, but here in this version, here's what matters right now. Your gut lining is one of the most primary sources of chronic inflammation that reaches the arterial walls. When your gut is compromised, it allows inflammatory compounds, lipopolysaccharides, viruses, and bacteria. They can get into your bloodstream and it can be continuous. So every meal is inflammatory. Every time your gut lining is compromised, your inflammatory load rises, and the research says your arteries pay the price. So remember, your digestive symptoms that you've been managing, they're not separate. They are a signal that your gut is compromised and that the inflammation it is generating is already starting to contribute to your cardiovascular disease. And what you have been doing wrong the entire time and your cardiologist has been doing wrong is you're focusing on cholesterols and triglycerides. Your gut symptoms and your heart are not 2 separate problems. They are one problem showing up in 2 places. Look, I've never worked with a heart disease patient with significant cardiovascular inflammation whose gut lining was functioning perfectly. Never! In 22 years, never. The gut connection is that consistent. When you address your gut integrity as part of a cardiovascular protocol, inflammatory markers improve, but if you ignore it, they don't. So remember, your digestive symptoms were never separate from your heart disease. They were the same thing the whole time. 3 signals, each one pointing at the same underlying process. Now look, the next 2 are ones that most people dismiss aggressively because they feel like it's just about their age. And they are the least like aging of anything on this list. Okay, so here we go. Before I get to the final 2 signals, if this video is helping you connect dots that no appointment with your cardiologist has ever connected with you before, hit subscribe. Subscribe to this channel. Every single week, I will cover the root cause side effects of cardiovascular and metabolic health conditions that your conventional cardiologist is not addressing. So subscribe every single week, guys. Cardiovascular root causes, everything your doctor isn't doing. Hit that button now. Make sure you activate the bell because you don't want to miss every video that we do and what's coming next. Okay, warning sign number 4, the weight that won't move no matter what you do. Look, most people with stubborn weight have been told the same thing: eat less, move more. The math is simple, right? Calories in versus calories out. And when that doesn't work, they blame their discipline, their age, or their metabolism slowing down. But what nobody has ever suggested is that the weight itself is a signal that is a deeper disruption. Listen, stubborn weight that doesn't respond directly to dietary changes is never a calorie problem. It's a signal, and it's a hormonal system of regulating fat that is being disrupted somewhere upstream, which is why the weight doesn't move even when your diet changes. So you're not failing at weight loss. Your body is responding to an internal environment that makes fat loss nearly impossible until the underlying driver is addressed. The weight is not the problem. The weight is the signal, and it's pointing at the same driving factor for your heart disease. Look, I've worked with patients who have tried every diet approach imaginable, and they couldn't move the scale. But when we began addressing root cause drivers of cardiovascular inflammation, their weight started to shift without them even changing what they eat, and without them even going to the gym. Not because we put them on a diet, but because the internal environment that was blocking fat metabolism starts to change. And when you stop treating weight as a separate battle and you see it as a direct signal from the same system driving heart disease, you stop fighting your body and instead you work with your body and with the information it is giving you. Okay, 4 signals down. The 5th one is the most surprising of all because it's something that most people would never in a million years connect to their hearts. But in 22 years of practice, it's one of the most consistent findings I see with all of our cardiovascular root cause patients. Your neck has been tight for years, but no one connected the tension in your neck and shoulders to your heart. Most people with chronic tension and or stiffness have been told it's posture, it's arthritis, it's aging, it's your desk, it's how you sleep, it's an old injury that healed, it's something you should just stretch out, go get a massage. It gets treated as a musculoskeletal inconvenience that has nothing to do with anything happening in your heart. But here's what most people don't know. The top of your spine, the part that sits right next to your skull, controls your heart through your vagus nerve, and it's automatic. When that area is under stress because of an old injury, a subluxation, years of tension, structural problems that were never addressed, the interference in the vagal nerve and the brainstem sends a signal to your heart. If your heart stops getting the instructions clearly, it compensates. And the surface sign of this interference is often exactly what you have been calling a stiff neck or tight back. The tightness in your neck and the disease in your heart, they are actually connected through the same neurological pathway. And this is a connection that I guarantee you your cardiologist has never mentioned. Chronic neck tension and stiffness in a heart disease patient, especially with a history of head or neck trauma, is a potential signal that your nervous system is controlling your cardiovascular system under a stress response. That is a cardiovascular finding, not a musculoskeletal one. When you have subluxation in your neck and you have heart disease, they're connected. And I've worked with patients whose blood pressure never stabilized with multiple medications when we evaluated their upper cervical spine and found significant vagal structural interference, tracing often back to an injury years before or something that they never addressed through corrective care. Their cardiovascular picture changes in massive ways because no medication can change vagal tone physically. Your neck isn't separate from your heart. It's one of the primary reasons that people with heart disease almost always have tension in their neck and shoulders. So when you treat chronic neck tension as a cardiovascular signal, rather than it being a postural inconvenience or a musculoskeletal pain, you open a door that conventional cardiology is never going to take you through. And trust me, behind that door is a powerful lever available to any cardiovascular patient for healing. 5 signals. All of them you probably didn't notice. All of them you probably dismissed. And all of them are pointing towards the exact same thing that no one has ever fully addressed. So now, here's what you do with this information. Because remember, knowing these, you'll start to recognize that the signals are not enough. What matters is the understanding of which ones are producing the most specific situation in you, because it tells you where you should focus. So today's exercise is not a diagnosis. It is a map. And having a map is different because if you know something is wrong and you know where to start, now you have a map and what to do. So today, find somewhere quiet and do this with a pen and paper, not in your head, but actually on pen and paper, because writing forces clarity of thinking and you can't do that in your head. Okay, step number 1. Rate each of these 5 signals from 1 to 10 on how they affect your day-to-day life. Fatigue, brain fog, digestive issues, stubborn weight, neck tension. Write the number next to each one of them and literally be honest. Number 2, circle the 2 highest scores. Those are your loudest body signals right now, and they are the ones you should pay attention to. They're the important starting points. Step number 3, write down when each of your 2 highest signals first appeared. Not when you first discovered them or when they were diagnosed, but when you first noticed that specific thing. For most people, this dates years before their actual diagnosis. And that gap is really important. Step number 4, write down every explanation that you have been given as to why those signals are there. Then write down anything about those as an explanation that gave you maybe some sort of lasting improvement. Did you do something about them that got better? For most people, the answer is, I have not. And that matters. Okay, step number 5, write this question down and sit with it. Has anybody ever looked at these 2 signals, the top 2, in the context of how they're connected to your heart? Look, if the answer is no, you know now what the most important next conversation needs to be. The signals that have been there the whole time, that no one is talking about them, you should pay attention to them. Okay, remember, your body has been sending signals for years. They either got dismissed, attributed to aging, or they were never connected to what's going on in your heart. And they were never random. They weren't unrelated. They were there the whole time telling a story in 5 different ways. Now, though, you know how to read them, you know what to do about them, and you even know where they're pointing you. So look, if you haven't watched the other videos in this series, they're all linked in the description below, but each one of them goes deeper into a different piece of what those signals are pointing towards. The links are below, and the next video is on your screen now.